Hi, my name is Associate Professor Alfred Kow. I'm a surgical oncologist with specialization in liver, pancreas, and liver surgery. I'm also a liver transplant surgeon. Let's start with L, liver cancer. What is liver cancer? Liver cancer, I think, generally refers to malignant tumor that is found within the liver. They are divided into two main types. Secondary tumors, meaning tumor that spread from another organ to the liver. We call it liver metastasis. Or it can also be primary tumor. Primary tumor can grow from liver cells within the liver, and therefore they are called hepatocellular carcinoma. Primary liver cancer, or HCC, is probably the most common that we are seeing in our part of the world. It actually belongs to the number 4 most common cancer that we see among men in Singapore. Part of the reason why it's so common in our part of the world is because Southeast Asia is endemic with chronic hepatitis B, which is the most common cause of primary liver cancer. Next is I, identifying suitable patients for liver surgery. Patients who are eligible for liver cancer surgery first need to have the diagnosis confirmed, and most of the time we need to assess the fitness of these patients. More importantly, from the liver surgery perspective, we need to make sure that the tumor hasn't spread to any other organs. If it is confined within the liver, then we need to decide whether the amount of liver left behind after the tumor were to be removed is sufficient for the patient to survive. The usual amount, what we call future liver remnant, should be in a minimum range of 20 to 25% for patients who does not have a liver cirrhosis. For patients with liver cirrhosis, unfortunately, the ability of the liver to grow back is poorer, and therefore the amount of liver left behind should be more, in the range of maybe at least 40 to 50%. Next is V, for various surgical options for liver cancer. There are different kinds of surgery that we can do for patients. Largely, we divide them into 3 big groups. Firstly is on surgical resection, which is removing the tumor and making sure that the margin is clear. Second group is, of course, liver transplantation, which is, in layman's term, changing of the liver. Thirdly is sometimes we can also do ablation or burning of the tumor through certain modalities. Removing the liver tumor, essentially through the technical exercise, can be done through open keyhole surgery, open robotic surgery. We will be able to then cut off the blood supply to the tumor part of the liver, and then making sure that the amount of liver that's left behind is continuing to be supplied by good blood flow, as well as maintaining the bound up flow of the liver, and then the patient will be fine. If we would talk about transplantation of the liver for liver cancer is an established treatment now since 1996, where there's a big studies that prove that primary liver cancer receiving liver transplantation within a certain criteria actually has very good outcome. There are 2 types of liver transplantation. The way how the surgery is done, it's either the disease donor liver transplantation or the live donor liver transplantation. E is for expectations. What would the patient expect after liver surgery? Again, the expectation will be a little bit different for surgical resection versus transplantation. So in comparison, patients with keyhole surgery, to be able to go back to physical activities, usually by the end of 1 week or 2 weeks, they should be back to normal. As compared to patients with open wound, usually it takes maybe up to 2 weeks to a month for them to recover fully, because the wound is larger. There are slightly higher chance that the wound may need some time to heal longer. As a result of that, to be able to go back to doing full physical activity usually is about a month. Last but not least, R for recovery. What are the chances and outcomes after the surgery is performed for these patients? The other very big component in the post-operative recovery of patients with liver transplantation is actually the management of the immunosuppression therapy. And in our center, we usually work very closely with our liver specialist, hepatologist that specializes in liver transplantation, to then make sure that the amount of medication that they use to suppress the immunity is adequate. We also work very closely with the infectious disease specialist to ensure that the infection risk for post-transplantation is lowest or suppressed to the lowest possible. What is important is actually the multidisciplinary, with various specialists coming together, the surgeon, the hepatologist, the infectious disease, our coordinator, our nurses, our ICU doctor, coming together as a team to provide the best care and outcome for our patients.